You're listening to The Revolution of Regenerative Medicine, a podcast with me, Dr. Gregory Laurence.
Greg's dad also has pulmonary fibrosis, so he was looking into it for that.
Oh, I'm very interested in that because my brother's dealing with that right now.
Yeah, so she's talking about this Greg.
Yeah.
Yeah, so and I meant to mention
Really?
that.
You hit a chord here.
The four of you, and the fact that my dad was diagnosed with pulmonary fibrosis, and he found out from his pulmonologist today in Houston that he's very interested in my dad going through a treatment. When I went out to California to train with the top guys in this, there were two pulmonologists that were there, and one of them said the reason I'm here is because I haven't been able to offer anything for my patients with primary pulmonary fibrosis. And I had a patient that went off and had cells done, cell surgery, and he came back with the first improvement I've ever seen with pulmonary fibrosis. He said, so I had to figure out how I could offer that to my patients with that and with COPD. So so it was really cool I was like, well, one of the reasons I'm here is because my dad was diagnosed, and he's on a medication that, I don't know, $50,000 a year or something like that. It was a really, really expensive medication. So we're trying to be really, really, I think I was telling Ione this earlier, one of the reasons you're going to see this grow really slowly, way more slowly than it should, is that doctors are a little bit occupied on making sure that we don't make any claims. We don't want to tell anybody, hey, this is going to work. We're allowed to say we're allowed to advertise actually, but if you do advertise, you have to be really careful about how you advertise, and a lot of doctors just aren't doing it. Some don't even have it on their websites, and because of that, it's really, really growing slow because doctors are just like basically on referral and things like that, treating their patients. However, you'll start seeing in some of the airlines. I have a colleague who's out of Seattle that advertised in their Alaska Airs magazine that they stem cell therapy right for you, kind of a thing. That's not making a claim. It's just saying, hey, there's this thing called stem cell therapy for chronic medical conditions. And so anyway. I didn't know. So So it's gonna grow really, really slowly because doctors. Also, we're trying to be very respectful to the pharmaceutical companies who are delivering drugs that compete and treat some of the same processes. Like I mentioned earlier, I think we're going to find that a combination of drug therapy and cell therapy is going to probably be it's going to rise to the top, but the pharmaceutical company can be very threatened by this, and we're trying to find a way that they're not threatened. I mean, they're going to be the ones that are doing the 3D printing and making the devices that help us to marry cells and be able to grow organs and really be able to do some cool stuff.
Dr. Laurence, you have brought up an interesting thing. Pharmaceuticals, as a rule, only can license artificial items. If it's natural, they may not license it, therefore poo-poo on anything herbal or natural, which is where pharmaceuticals began. Stem cells are actually natural and not artificial. How does that fall into the pharmaceutical picture?
So it's really, really tricky when you see things. I'll just give you an example. Vitamin C, of course, is never going to be patented by a drug company. Testosterone is never going to be patented by a drug company because it's naturally occurring and they're not allowed to own nature. So they're never going to really pursue that with as much zest as something has the potential to be a $10 million drug. So that's where your doctor has to be your advocate, because we have a wide latitude of being able to rub compost in your wound if we think that's the best thing for you. I mean, we're liable for being professional and doing things right and things like that. And some doctors have taken that too far. For instance, whether it's effective or not, there have been, I'm not even going to mention any specific kind of natural compounds that doctors have maybe trumpeted more than they should and maybe taken advantage of patients. So we always have to be really careful that if we can't find any colleagues that agree with us on a natural therapy, or we don't have some really, really good data behind it, we really have to question our motives. But there's been some incredible data with vitamin C and what it can do with viral infections. There's been a lot of reports on oncologists starting to augment their chemotherapy with vitamin C, and then of course some of us said, well, what if you just did the vitamin C by itself? And that doesn't seem to really be an option for economic reasons. But I'm not an expert, and I can't really judge about whether some vitamin C preparations might be just as efficacious as some of the minor chemo agents. I think they're better, or friends, and they can work together. You get a lot of patients sometimes that will take the natural thing to an unnatural degree, and they just feel more comfortable with natural, and so they'll really kind of turn down a drug therapy that is very, very effective because they just want to go natural. And I never disrespect those patients. I understand where that's coming from, but to me it always seems more harmonious if they take advantage of the drugs that have been demonstrated to be effective and somewhat safe, along with those natural interventions as well. So in a second, they would promote a mouse-derived
growth hormone.
Right, because then they can get around that whole,
Correct.
it's not natural.
Correct. So
First growth hormone was from cadavers.
Was it really?
Yeah. And now it's all lab.
yeah, they put a DNA into a
Yeah.
bacteria and they
They
grow
are
it
now
out
all
with
synthetic,
all
you're right.
synthetic.
Clostridium or whatever.
Yes. That's sad that we have to make it synthetic before we're allowed to use it.
Right.
Yeah, I think. Well,
About the money.
yeah. So I'm real I'm real charitable when I say I know that the engineered cells are going to have a place, and we welcome them. And trying to help figure all this out. But in my heart of hearts, I don't think it makes sense that an engineered cell is going to perform better than your own cell that's not engineered. Now, we might need to grow it up. We might need to expand the culture and give you 50 million or 100 million cells rather than give you, 20 million. But at the end of the day, that's going to be really fun. Thank you for listening to this episode. Be sure to subscribe to my podcast, The Revolution of Regenerative Medicine. I'm Dr. Gregory Laurence, and I look forward to you joining me again soon.